Dr. Julie here with you. Welcome back. Today's topic is, what is functional medicine? The goal is to give you a definition by comparing a functional medicine doctor to a traditional medical doctor or a functional medicine practitioner. Not all functional medicine practitioners are doctors. So let's go. So let's first compare a visit to a regular doctor and the time frame between a functional medicine practitioner versus a traditional doctor. Your time frame during your visit with a traditional doctor will probably take between 10 to 15 minutes at most. The average, I believe, is 4 minutes. Versus a functional medicine doctor, your first visit is expected to be between 1 hour to possibly 2 hours. And the reason for that is the amount of information that's being gathered. The approach for functional medicine is a bit different from a traditional doctor. So during your first visit with a traditional doctor, you will discuss your symptoms, and then the doctor will come up with a diagnosis. And from there, he will go ahead and give you a drug that matches your diagnosis and then send you home. For a functional medicine doctor, it would be a bit different, where we are trying to understand your lifestyle. We're trying to get more information on your medical history, your family history, your genetics, understanding your individual biochemistry, and just a personalized approach to understanding the core issue to your symptoms. So we're definitely interested in your symptoms, but we also want to understand how long it started, what else started with those symptoms, and just digging deeper and investigating to see. The goal is to figure out the core issue. We don't want to cover up the problem by resolving the symptoms. We want to understand why it happens and actually treat that cause. And to be able to actually get those information, labs may also be important. It can be blood labs, it can also be hormonal panels, or even doing a elimination test, depending on, if it's a dietary issue. And all of those tests or labs will actually allow us to dig deeper before we can even give you a diagnosis. Now, you may still be on a treatment plan without getting a diagnosis, which is the prevention part of functional medicine. That's a bit different from a traditional doctor. Traditional doctors don't necessarily practice prevention. So if your labs come in and a medical doctor sees it, a regular traditional doctor sees it versus a functional medicine doctor, we have to pay attention to the prevention ranges where you're almost at risk, and we're paying attention to the range where you are considered diagnosed with a specific disease. But a traditional doctor, if you're not within that range where you are diagnosed, then they're not going to treat it, or they're not going to really pay attention to it until you're in that danger zone. For a functional medicine doctor, once we figure out exactly what's going on and you have a diagnosis, or we know what we want to prevent you from becoming diagnosed, whatever disease that might be, you're at risk of being diagnosed of, we then go into the treatment plan. And the treatment plan will consist of nutrition therapy, lifestyle changes, as well as supplementation if needed. Now, supplements has not all naturalists or functional medicine, we care for supplementation, but not all practitioners really want to give supplementation. I believe in supplementation simply because what you are missing, it might be a lot faster for you to get back to the level of minerals or vitamin that you need to have in your body with supplementation versus diet. So for example, you might have to take supplementation for a certain time frame until your level of mineral or vitamins are back to where it needs to be, and then you slow down on those supplements and then you implement your dieting to pretty much get all of your vitamins and minerals. Now, dieting is not always the best way to fight deficiencies because it just takes a lot longer for your body to absorb it, and you just have to eat a lot more of this item. You know, if it's vitamin C that you're missing out on, you would probably have to eat broccoli for breakfast, lunch, and dinner for the next 3 months just so you can get it, compared to just taking the supplementation. So the approach to functional medicine is, my role is to pretty much help you take a driver's seat of your health, but I would be very proactive in assisting you and guiding you to the right path, but you're still in control. You are still the one making a lot of these decisions, and as we educate you, we're just letting you know which options are best, and you're still adapting these options to be best for your lifestyle. So functional medicine is different from, different from traditional doctors, where it is more specific. It is personalized, custom to you and your needs. It's also natural and holistic, as well as it addresses the core issue and not just cover up the symptoms. Now, when I make these comparisons, I don't want to down talk medical doctors, traditional medical doctors, simply because they are extremely important. Now, some people might do best with a medical doctor versus a traditional doctor versus a functional medicine practitioner, simply because they might be severely sick where functional medicine may not benefit them, or the other way around. Regardless, there's an importance in both doctors. There's just differences between the two, and both are necessary, all depending on the space that you're in throughout your health journey. So you can think about it, make a decision. If you've never seen a functional medicine doctor before, you can definitely look one up in your area, and you can always reach out to me on social media or my website, and I'm definitely here for you to answer all of your questions and to assist. Thank you.